Thanks for joining us for part three of our three-part interview series with Brendan Keeler. In case you missed part one or two, be sure to check them out to learn more about Brendan's experience at Epic, Epic's company culture, the evolution of interoperability, stories about Epic's CEO Judy Faulkner, and a deep dive into healthcare interoperability. In part three of this series, we learn about his experience initially working with Judy at Epic to eventually working with Jonathan Bush at Zeus Health. He shares some unique stories working for Jonathan Bush and how it was working for two of the most iconic health IT leaders. We then shift gears to talk about the EHR market, including whether Epic is a monopoly or not. This includes talking about information blocking regulation and how it will play a role in any antitrust concerns. Brennan also shares where you can connect with him, including details of a unique Epic alumni community that was recently created. Now, let's check out part three of our conversation with Brendan Keeler. Let's shift gears a little, do something a little fun. You mentioned the two spectrum, right? Judy on one side, Jonathan Bush on the other. I call him the greatest interview in health IT because you just never know what he's going to say. And to your point, he's brilliant. Brilliant mind, with a little bit of a loose cannon, maybe.
Well
Understatement.
put.
Tell us about what it was like working with Jonathan Bush at Zeus Health. You got to have a story or two.
Yeah, I mean, just a brief transition. So, like, I was at Epic. I left. I did the sabbatical. I go to move to San Francisco because both my wife and I had family there. We didn't want to go to Philly or Portland, where like, the actual family is,
Okay.
and make a choice of where we live forever. And move there. I'm like, I need to be in like a startup. Like, I've been in Epic. Like, let me find startups. So I applied to like 40 startups. It's a terrible experience. Like 20 don't respond, terrible interviews. I finally get really deep with this clinical trials management system, study startup. So like kind of moving adjacent and called Go Balto. I'm deep with them. And meanwhile, I'm also interviewing with this company called Redox. There's a lot of ex-Epic people, very closer to what I've done, but remote. And this was pre-pandemic, and remote was like, it's like I moved to San Francisco to work for a remote company. Like, what the hell is this? And I'm leaning towards Go Balto, but they just all of a sudden go quiet. And I'm like, man, that's weird. And I get an offer from Nijay, who was the head of product, and Lupani, the CEO, and Nico. And I'm like, man, these guys are all awesome. And I go back to Go Balto. I'm like, hey, can I get a job? Like, can I get an offer? And they're like, no, no response, no response. So I just end up taking the Redux job because I want a job. And thank God I did one because Redux was a tremendous like community culture and like also like off ramp from Epic to startup world.
Yeah, good transition, I
And
think.
Go Balto comes back to me 2 weeks later and they go, hey, sorry for the radio silence. We want to offer you a position. The reason we were radio silent is because we were acquired by Oracle. And I'm like, dodge the bullet, you know?
Yeah. Like that doesn't sound startup-y.
Well, that's part of you, right? Like I have friends who are working for Oracle and Cerner, like for Cerner Oracle, and I think there's really cool stuff they're doing now. But Oracle is not a startup. And so like happy that didn't happen. I worked there for a number of years. Um, and then pandemic hits, I move up to Portland, Portland, Oregon, not Maine.
So you
And
did family.
I did. My wife was like, how about, I'm like, man, I thought we had 2 more years in the Bay. And she's like, come on, we're paying so much for rent during the pandemic and we can't enjoy things. I'm like, all right, many people fleeing New York, San Francisco, not a unique story. But I move up and I start writing Health API Guy because I was writing for internally for Redox, and then marketing said, "Hey, this is really good. This history of standards. Like, can we publish it externally?" So I work with the marketing team. We publish it. We publish another thing. I'm like, "Oh, that's cool. Writing externally." And then marketing changed organization or something, and they're like, "Hey, editing. Like, we have tickets. It's gonna be 8 weeks to turn around any editing." I'm like, go to Luke, the CEO of Redox at the time, and I say, Luke, like, this is slow. This is like glacially slow in this industry. What should I do? And he goes, well, why don't you just write on Substack? And I'm like, okay, like that's sweet. What is Substack? And I start doing that.
Yeah.
And it becomes a place to just put any thoughts or ideas where people ask me when people ask about things and I want to write them down. And
You're great
Jonathan,
at it, by the way. I don't, You probably deserve a Sway Health Award. We'll see how, someone needs to submit you this year. Because honestly, I mean, you do like, you're not a journalist, right? I don't consider myself a journalist unless I need a press pass, right? And sometimes I do journalistic
I'm a
things.
journalist. Let me into
I
UGM.
mean, I do journalistic things. To be fair, everyone's like, "Yeah, you've published that many videos and articles. You're a journalist." But I mean, but to me, I think you take a similar approach, which is, how can I be useful to people? And anyway, I just want to give you your kudos because what you write is really useful, and it gives you that insider perspective that's really valuable.
I appreciate that. I mean, my recommendation to anyone is to write and write for yourself because it's a good habit to congeal thoughts. Then write for internally because then you can share them internally, and that's a good skill to have. And continue to write further and further out. It doesn't matter if it's 10 people or 100 people that read it. If it's, it helps.
Forces you to think.
Yeah, it forces you to think. And so I think that that's what it is for me. Um, and I think that people can benefit when they take that approach versus being like, I need to market my company. What should I write about? Write about things you know, and you selectively by doing that write better things and attract the people interested in having a conversation about those things, or just um, find that the niche, finding a niche that care about the things you care about. And so yeah, the only way you do this is by shooting your shot 5, 10, 15 times.
Well, and
Um,
sometimes you get lucky and can quit your day job and do it full time, but that's a
there you go. There you
that was
go.
my story 15 years ago, but
Yeah,
but a
exactly.
bit lucky.
Exactly. You just you progress down the thread, and you find there's always some benefit, and you can just become sharper in the way you think because it forces you to research, so you don't sound like an idiot on the internet, which is inevitable. At least for me.
I mean, that's what you have to be okay with as you write. You have to be okay to do something wrong. And people are like, "What if you write something wrong?" I'm like, "Then they'll tell me." And I was like, "There's always two choices. Either they're wrong and I can ignore them and whatever, right? Or I can fight back, or they're right and they just educated me. That's okay. Like it's
Oh,
why
and
do we
owning it
expect
too. Owning it too is important, right? If you go and you write something wrong, and then you go, Ben Thompson is like the OG. He's not in health tech; he's in tech, generalized tech, but he's like the inspiration for Substack. He he's wrong frequently with his predictions, his analysis, right? But he owns it, and he'll come back to it and say like, "Hey, I predicted this, and here's how it's changed my thinking." And I think um, having a level of fallacy and a level of understanding that you will inevitably be wrong because of the depth of things that you don't know, just allows you to continue to learn, and also people to say, oh yeah, this person isn't just up there puffing their shit. They're owning their own growth and education. So
perfect?
anyway,
Yeah. So get back to Jonathan Bush.
yeah, this is
So
very
you're writing the
long-winded.
Substack, and then how do you end up at Zeus?
Yeah, so Ada Glover, the chief product officer at Zeus, reaches out and says, "Hey, we're working on this new thing. It's headed by Jonathan Bush, who the only person who ever we never talked about competition during staff meeting at Epic. The only time we did was Athena Health. And that
Wow.
was when the period of Jonathan Bush, that was when they had this pitch where like we can install in 5 days to practices. And
Yeah.
we're scaling because of the SaaS aspect, and they're all over things because of MDP. And Judy got on stage and she's like, how do we get down to 5 days? And we're like, Judy, these are 2-year installs. Like this is not how we will not be them. But and maybe we shouldn't be, but like it's the only time I can recall talking about competition, except for the chart that I think you published and or you somebody's maybe it's his talk of like the consolidation chart of all the EHRs. That was always there as like a reminder of Epic never merges or acquires.
Didn't see
Anyway,
that.
so I'm
Yeah,
like, I
you'll
got
love this quick story. I wrote an article. I was working in the ambulatory side when I started, right? And I implemented a doctor's office. It was one of the doctors worked. He was starting his own practice. He's like, "Hey, John, we go live on Monday. Can we implement the NEHR?" And this was like Wednesday. And I was like, and we talked about the EHR, and he would selected one. And so I wrote an article. I implemented the EHR in 2 days. because we had to, because his choice was I'm going to start some paper and then I convert. Like what world would I want to do that? So we did. We implemented it. And CIO Will Weeder, candid CIO blogger. That's it's back in the early days. He wrote a comment on it. Or this is before social media, so you had to use comments. He wrote, "John, you lost me at 2 days." But perspective was that, right? I'm a hospital system. I need years, right?
Yeah, I mean, okay, so like the difference, and this is lost on digital health because a lot of digital health thinks of the ambulatory experience as like what defines an EHR. And ambulatory EHR is very complex, don't get me wrong, but is
Yeah.
infinitely less complex than the Rube Goldberg machine of inpatient and like the sprawl across specialties, right? Like the difference in the workflow of the ER versus the cardiology department versus the ICU versus an operating table is
Let
tremendous.
alone the lab and the pharmacy and the
100%. And so like, like the idea of a quick 2 day or 5 day install or like click to install EHR is possible for the single doc practice, like the outpatient
it wasn't
experience.
ideal, by the way, but
Yeah, but
we
like it's
did
still,
it.
you can go spin up an instance of Canvas, like boom. Um, and so yeah, I just remember her being, like not shook, but like, she definitely took Athena seriously for good reason because it was a threat. Um,
Well, he was ambitious.
yeah. And so I was like, I gotta meet this guy. Like, I gotta take this interview because,
You got to
like,
do the interview just to meet him. Interesting.
yeah. Well,
Makes
also,
sense.
like, I was feeling, it was COVID and like you're not seeing people in person, which was really important for remote culture and things like that. And I just felt stuck at Redux at the time. And so I was like, let me just do something different. And so I took the interview. I think he was on a boat, his boat Zendaya, when I interviewed with him, and I'm like, man, what a character. And so they said, hey, come be a PM in one of our founding 5 PMs, and we're gonna build all this stuff. And he's painting this picture of build a bear for healthcare and all this stuff. And so like just the some will call it word salad, some will call it like art. His way of describing things is incredibly captivating, and um he can go from talking about like like Princess Bride all the way to like Odysseus, just like that. Like he is incredibly well read. He's incredibly able to pull anecdotes and stories and metaphors in a way that's very inspirational. But you said it really well. Loose cannon sometimes. And so I thought it was really fun to work with him. I got to ghostwrite with him and collaborate on a lot of stuff in addition to doing the PM work at Zeus Health. Um, and yeah, the speeches, he has a penchant for standing on tables and giving speeches anytime he's at a big event.
Oh,
So I think if I ever get the chance to go to a wedding and he's there, I'm sure we'd be like-minded or similar. Maybe we'd be competing on the dance floor. Who knows?
you know who he reminds me of? He reminds me of Mike Leach. I don't know if you follow college football at
Oh
all.
yeah. Oh yeah.
Mike Leach is Jonathan Bush to some degree. And when you read about Mike Leach and his football meetings where he's talking about philosophers Socrates and how that applies to the whatever, Mike Leach is most famous describing which mascot would win in a battle or which because like Jonathan Bush has that same kind of like I gotta hear what he's gonna say because it's gonna be awesome.
Gen Z, I believe, call this aura. He's got aura, and so if you love him, which you believe in his candor, his ability to inspire is special, which I think is true. And the people who don't typically don't like bluster, typically like less of the vision and more of the concrete. And he has people for he is the visionary. He has ideas that nobody else has.
Yeah.
So. I think he's polarizing just like Judy's polarizing. But to be successful, means you inevitably polarize. There's no one who's universally liked. And
Well,
Mike Leach definitely falls in that category as well.
for sure. Well, I mean, and it made sense. He had I forgot the guy's name that was his co-founder at Athena Health that became the, CTO of HHS,
Todd Park.
Todd Park, right? Like they were the yin and yang, right? Like that's what you needed, right? Todd was the down the line, execute all that, and Jonathan was the visionary. That's why they were successful. Made total sense. So let's hit one more topic. I know we're nearing the end, which is interesting to say. Like I can't believe 2 hours of, but we love this. I'm glad you love this as much as I do. So this has been fun. But I want to talk about kind of this, maybe the EHR landscape picture. Like, where does all of this head, Epic versus, you know, are we allowed to say Cerner, Oracle Health, Meditech, versus the ambulatory ones, which still have a big stranglehold, I think, in a lot of ways on the ambulatory side. There's some interesting, yeah, it's probably more, the ambulatory side is more a prediction of how health systems are going to chomp up ambulatory or not, is probably a better prediction of how that market's going to go. How do you see this playing out? And, obviously, as part of this is the antitrust lawsuit against Epic. Are they a monopoly? How do you picture this playing out over the next little bit? And maybe we'll get to barriers to interoperability too. But how do you see this EHR landscape going forward? Anyway, I'd love to hear your thoughts.
Yeah, I mean, I see the rise of Epic is what we can attribute to the trends we see right now. And the rise of Epic plays that integrated database that allows for it. It is extremely appealing to large health systems. And we'll continue, like we continue to see losses by Cerner, losses by Meditech or legacy, like MedHost and things like that, because of that draw, the siren call of an integrated single tool. You don't have to worry about security reviews for 100 vendors and different payments and contracts. Like all these forces,
One person to go to.
yeah, are really appealing at the large health system side. And so I think we see this similar picture of what we see today, which is Epic continuing to eat market share. Cerner, maybe I'm interested to see how they return with their new platform, with their, they brought in a lot of technical talent. They have Larry Ellison backing them. But like looking at first principles and not the emotions, it's like the same principles of an integrated database and things like that, barring large scale changes to healthcare dynamics, like the shape of insurance or things like that. It doesn't seem to change. It seems to only continue on the trend that it's been in an
Well, the
inexorable.
argument they might make is that same principle that you're just applying, they would argue, I'll argue for them, is needs to apply across the EHR and the ERP, and that they can do that better. That's their argument. Is it true or not is an interesting question. Is that really integrated or not? That is a reasonable question as well. And then I would ask the question, is it too late? But yeah, go ahead.
Yeah, I mean that's the thing is like there's the market perception, there's the FOMO and things like that. There's a lot of things for them to combat. So like it is an uphill battle, is what I would say. I don't, like who knows what the future where the future lies, but you know the negative press of VA and things like that don't help their cause. And so like they need a big win and they need something that's not like, oh, we had some, sepsis, like we reduced sepsis or something like that. That's not the type of big win that they need. And so I don't think that's what disrupts Epic. I think it's the things that we've hinted at: information blocking, antitrust, anti-competitive behaviors. Like that's where they're at. And I don't know that they're fully cognizant of that, right? Even though it's been years that they become market leader, as a market leader, you are held to a different standard. And as you move to monopoly, you're held to a distinctly different standard. It is not illegal to have a natural monopoly. It is only illegal to have a monopoly if you are using your market power in an anti-competitive way, historically to the detriment of the consumer, right? That has been the third piece of it. Um, there's changes in antitrust that are happening where bipartisan antitrust is being considered and being used, where actually you can look at things like Apple or Google and some of the things that the antitrust charges are being levied against them. They actually result in a better consumer experience at a lower cost, potentially. And yet we still think there are other societal reasons that antitrust may be warranted. That may play out, but by the historic definition, what needs to be proven against Epic, and they need to be wary of and change how they do things to accommodate, is when they use market power and to act anti-competitively to the detriment of the consumer. And so that can play out like we saw with Particle via Epic, right? The case we can get into, I've written about it, and I'm sure we'll talk more about it in the future. It can play out with the app ecosystem and the way they price and bundle their products for oftentimes $0 to compete against ancillary products, which have innate cost, either self-imposed or imposed because of the APIs that they use. And so they can point and say, we've always done things this way. Our products have always been bundled together. We've always leveraged the integrated nature. We've always, the act of leveraging our provider weight to sell to other markets is natural. But the reality of monopolies and antitrust is that you have to operate with a hand tied behind your back. Whereas previously in the eras before, as the upstart, as the up and comer, as the disruptor, as the player, you could operate and do different things. And so that's the challenge of market dominance, is that it will be unfair that others can bundle their products together, that others can use price tactics that you can't. But that is because of the nature of being the market leader and having the innate distribution advantages, the innate advantages of large market share.
Well, and it goes back to the point I made that they're so customer focused that I think they're going to bump into situations where the customer focus and what's best for the customer may go against this whole monopolistic power perspective, whatever situation that they're in, right? Where it's like, and that will be an internal struggle culturally, I think, to your point, where they don't see. They're like, well, like in their minds, they're like, well, I'm just doing what's best for the customer. But from an external perspective, maybe seen as, no, you're you're doing something monopolistic that isn't going to play out that way legally. And so that will come into conflict, right? I've had this discussion before too about that customer focus. It's like, well, what happens when the customer focus is, different than maybe what's best for the patient? Like that's another example where that is a tough challenge for an organization that's very customer focused and also does care about the patient. Then how do you reconcile the two? Sometimes they're at odds.
Yeah, 100. That's really well put in an angle I hadn't thought of that I think is spot on. And so, like, a cultural change, a strategy change, changes to prices, changes to packaging, changes to messaging across their organization, like, will be required to. We are in an era where antitrust is bipartisan, right? There are, of the three possibilities after the selection, you have Trump potentially winning, and then Vance is like friendly with Lena Khan of the FTC, and so like very actually pro antitrust because he comes from a VC background and favors small tech, right?
It's a popular position.
Yeah.
Who likes Trump? Monopolies.
Yeah. Yeah, I mean, well, then you have the chance of Harris winning and continuing Biden's policies, which have been a lot of antitrust. We saw an antitrust lawsuit against Visa, a relatively weak one, but like it just happened last week. And there's been plenty against Google and other things that have happened during this administration. So she could continue that. There is a possibility that she reverts, and this depends on whether you believe that with the Republicans' alignment with small tech, that they lean that the Democrats say, oh, we're going to lean into big tech, and so then she might get rid of Lena Khan, and then you have more of a posture of like Republican small tech, big tech being a Democratic position. We're not there yet, but like that's the spectrum of possibilities, and two of those three continue sort of the antitrust movement we've seen because consolidation has happened across all these industries, and power is continuing to accrue to tech platforms in a way that is societally challenging.
Yeah. It's going to be playing out, not just in healthcare. So I think, but it's going to impact healthcare, the roll down effect. I appreciate you taking all this time. I want to throw this one question, and in some ways, I feel awful that I'm asking it now and didn't ask something earlier about the patient. Like certainly, healthcare is a business, and it's important that we talk about the business and the interoperability is there. But man, I'd be remiss if we didn't hit the patient just a little bit, and hopefully you have the time and you're not,
Yeah,
since
yeah.
we've gone plenty. But what would you do if you had a magic wand, that Brendan rubs the lamp and he gets one wish, not three, but what would you want to see in interoperability to benefit the patient? What would you want to do? What change could happen that would benefit the patient more than anything else if you could do anything when it comes to sharing data? Because here's the ironic part of this whole interoperability discussion. Patients think it's already happening and it's not, right? Like we assume as patients that our doctors are talking and sharing data. Like we aren't even mad that it happens. In fact, we're mad the opposite. You didn't do it. Now, why didn't you do it? Because that would have helped me and made my life easier. And then even if you look at it, doctors, when they thought that they were implementing EHRs, for good or bad, and for lack of understanding education, they thought interoperability was going to be solved by EHRs too. It was an ignorant viewpoint because there, when you look at the $36 billion of stimulus, none of us thought, oh, interoperability is going to be solved. Now you're going to have all the data that you want when you want it, right? Like anyone that knew the details knew that wasn't, but many of them thought that that's what was going to happen. Anyway, that's a little sidebar. What would you want to do for patients?
We got it. Like this should have been earlier because there's a lot to unpack here. And one is that patients, again, mapping out interoperability, breaking it apart into exchanges between different participants, and what are those workflows? If you look at specifically for provider to patient and not payer to patient, you can see a number of workflows, right? Like I'd like to schedule, I'd like to pay bills, I'd like to have access to my clinical data. And those are aspects of interoperability. They're all solved or semi-solved or not solved, right? The specific one people gravitate towards because the idea of a PHR is like the actual siren call towards the rocks that have killed a million startups ends because it doesn't because we we have only focused on making that better and we're still not there yet. We started with HIPAA and said HIPAA right of access, non-digital, but you can go get your data.
Yep.
Underpins everything. You still have that as a
Deserve
fallback.
access to your data. Yep.
Yeah, great. You have that as a fallback. It's manual, it's not digital. We tried to do better. We did through meaningful use, VDT, view, download, transmit. You can download a CDA from the patient portal. You have access to your data in a computable format. Clunky, non API. It doesn't lend itself to like aggregating, but a capability people use, and often if you're very sick, you use effectively. Uh, we then in Meaningful Use 3 said, let's add APIs, but they were just like, it was brand new. What's an API? And so they had to go do it. It was very disparate, but you saw the rise of aggregators like OneUp Health. Be Well started with that. And so that allowed for API access to aggregate data, but had the clunkiness of username and password. We had Cures Act, which then said, let's make it all FHIR, same thing. And like they tightened it up. And now that's ubiquitous certified capability with FHIR R4. And you can do that, but it still has username and password. So it's still hard. Do I have a username and password? I did a couple of years ago, I did a piece where I signed up for every MyChart in America. Can you do so? Can you get it? Or do you have to get an access code? Do you have to go do like really clunky registration workflows? And that's epic. Like that's if you scale that across shitty EHRs, you see very prohibitive practices to getting an account, which precludes your ability to get your data. We now have the promise of individual access services via Tefka to again level us up to allow for, hey, I'm John Lynn, selfie, document, proved my identity, now pull from every care institution to use how I want. And so we get to that point, we've solved one workflow. We've solved the aggregation of clinical data. People really like that. That will facilitate a lot of things that are right now that will let off steam on these workflows of non-HIPAA entities that are using secondary use. So instead of saying, hey, I'm a law firm, I'm going to go use secondary use in an opaque way. Well, shoot, I can use the patient. The patient can have consent and be very clear and we do it transparently. And it lets off steam on these other dark patterns and enables the patient. So I want that as the next step for the patients. And then I want administrative workflows because the bell curve of patients, there are the sick patients that need their clinical data and need it aggregated. There are the extremely fit patients that do it because they're into their like Fitbits and stuff. But the bulk of us just want to schedule appointments and do administrative things and want to do it very, very easily at scale. Find the right provider. Is it under insurance? Like the administrative workflows, enabling patients with those superpowers that providers have of checking eligibility as a patient. Am I eligible? I should be able to check.
Yeah.
But like we're so far for a variety of reasons from solving that part, which we're going to solve this clinical data thing and be like, shit, I still feel a lot of pain as a patient. And it's because we have not focused on these like the actual workflows. I mean, don't get me wrong, aggregation of clinical data enablement is gonna be so impactful, but we still have a ton of other work to do in terms of scheduling, eligibility, financials, communicating back to the EHR.
Messaging the doctor.
Yeah, yeah.
Yeah, that's interesting. Yeah, no, I mean, I think you're right. Even if we got all the clinical data, there's still so many other areas that as a patient I need to solve. And it is a function of healthcare being such a disparate system, right? There's so many players, and even ones on the same EHR often is so dysfunctional. So yeah, well, I guess we should have made it 3 hours, but yeah, no, Brendan, this has been everything I thought it would be. It was awesome. You have such a depth of understanding, some great stories. Hopefully everyone else appreciates it. I'm sure they're going to let us know in the comments or on social media if they love or hate the long form format, but I loved it. So I'm grateful that you took the time. As we wrap up, tell us, what are you working on now at HTD Health? What do people need to know about that? Talk about your Substack, where they can find it, and of course your Epic alumni community. Anyway, this is your time to let us know, where can people find you.
Yeah, sure. I mean, reach out to htdhealth.com. If I'm the practice lead there for interoperability projects, but we help with strategic consulting and development of applications. So if you want to integrate with an EHR, you want to solve any of these workflows we've talked about, like come talk to us. We'll help you navigate the landscape. We'll help you create that solution. Healthapiguide.substack.com. If you just want to learn, see a few memes, sometimes some dicey ones, right? And then if you're
Got a
ex-Epic,
good name game.
yeah, Epic, just come. It's a fun. We're posting Judy stories and memes. We've got there's jobs for ex-Epic people that people circulate. There's meetups. There's all the sorts of things you'd expect, and it's a good way to reminisce on what was for a lot of people a very formative experience. Not everyone's still in health tech. I think we have one guy who's like leading a cult or something. It's really a really awesome community. So he went from one cult to another, I guess. And so anyway,
Well, I've been to UGM, so does that count as alumni? Did
you're no outsiders. I'm sorry, John. You got to go work there for at least 3 months.
I'm gonna ask someone at Epic, can I work there for a day just so I can get in the anyway.
There you go.
No, it's awesome you're bringing them together. It's something that I think we miss in society, and I'm applaud you and all your efforts is bringing together communities of people. So Brendan, I appreciate you so much for taking the time, and appreciate everyone for watching this. Definitely let us know what you think of the long form format. Be sure to go check us out at healthcareittoday.com. We'll see. Maybe we'll push this out as a podcast too, and they'll be like, "What's this 2 hour podcast?" And they'll be fascinated by it as well. So you can find Healthcare IT Today on your favorite podcast application as well. Thanks so much, Brendan.
Hey, thanks a lot for having me. Talk to you later.